Welcome to Let Me Fix This. Enjoy the video.
You begin by quickly assessing risk. Determine if your cloudy vision started suddenly or gradually and whether one eye or both are affected. Once you know that, remove any contact lenses and wash your hands thoroughly so you won't introduce infection. Make notes of recent eye injuries, new medications, allergies, and exactly when symptoms began. This information guides the next steps. If you have sudden pain, flashes, or severe vision loss, stop and seek emergency care immediately. Now you tackle common reversible causes. Gently inspect the eyelids and lashes for crust, foreign bodies, or discharge. If debris is present, flush with sterile saline. Use preservative-free artificial tears to relieve dryness. Wait 5 to 10 minutes and reevaluate because lubrication often clears transient clouding. If symptoms began after a new medication or allergen exposure, stop that agent only if it's safe and you're certain. Then monitor for improvement. If vision, finish by deciding if professional care is needed. Persistent cloudiness, sudden vision loss, significant pain, or new light sensitivity warrants urgent ophthalmology evaluation. Once seen, clinicians may prescribe targeted drops, remove a foreign body, treat infection, or recommend cataract assessment and imaging. If treatment doesn't help, make sure to request corneal staining, OCT imaging, or a dilated fundus exam to identify subtle causes. And if symptoms worsen at any point, return immediately. Early intervention prevents lasting damage.
Thanks for watching. If you found this helpful, don't forget to like and subscribe.